Hello, and welcome back to Claremont History YouTube. Last week's video was about Florence Nightingale and her impact on public health. This video and the next one are going to be in a similar vein on two aspects of British public health history that aren't covered so much. During the current health crisis, scientists are working overtime to try and come up with a cure. Unfortunately, sometimes something bad has to happen for us to be spurred into action or to learn from our mistakes and stop it from happening again. In the early 1900s, it took war for the people of Britain to learn an important lesson. Between 1899 and 1902, Britain fought the Boer War. This was between Britain and farmers of Dutch descent in South Africa. Of course, it was definitely not a battle of who was going to give the land back. As ever, it was about empire, a controversial and often complicated topic. So instead, we're going to focus on the big lesson learned from it that is in many ways responsible for the way that Britain looks after its citizens today. This war was supposed to be over pretty quickly, but what they found was that the Dutch could fight pretty hard. So Britain needed soldiers and started to recruit men. The health standards of being in the British Army back then were reasonably low, but actually there turned out to be a serious problem. When the men were checked, they found that 40% of them didn't even meet that very basic standard. And if they were from a big city, then 90% didn't meet them. It was a huge scandal. The country was run by middle and upper class men who were not concerned with the living conditions of the working class, the men who would have been fighting in the Boer War. Now they were spurred into action. A special committee was established, and in 1904 they released a report. This admitted that many men were unhealthy, and if the men weren't healthy, well, that surely meant that their families weren't either. But why were they so unhealthy? Well, for starters, they lived in incredibly cramped conditions in slums. Large families in small flats that were really just a room in a building full of people, which of course meant that it was a breeding ground for disease. If one person in your building caught something, then everyone would. Pollution was a problem too. Working class people tended to live near the factories they worked in and would be exposed to the terrible smogs that they produced day and night, and that meant their children were being as well. And what about food? Well, they were so poorly paid, they couldn't actually afford a decent diet. We don't think twice about having 3 meals a day. A Victorian family would have been incredibly jealous of this. People are incredibly wasteful today with food as well. A working class Victorian family would have savoured every morsel. Alongside the government report that was made, 2 other reports were created as well. Life and Labour of the People in London by Charles Booth found that 30% of Londoners didn't have enough money to eat properly, even though they were in full-time employment. He showed the link between poverty and a high death rate. Obvious stuff to us now, perhaps, but they needed someone at the time to actually demonstrate that. Meanwhile, Poverty, a study of town life by Seabaum Rowntree, found 28% of York's population weren't actually making enough money for them to survive on. People were finally recognizing that poverty and poor health were definitely linked, and they were lucky because people were also starting to change the attitude about government. They started to believe that it was the government's duty to look after the citizens of the nation. The Liberal Party agreed with this sentiment, and so they started to push for policies that would improve the lives of the British working class. They were also a bit worried about the Labour Party, which was new and up and coming and stealing their votes, but let's just focus on that side for now. Another good way to encourage change is to link it to the economy. People started to worry that if Britain's industry was going to fall behind other nations if they didn't do something about their workers. Unhealthy workers can't produce. The Industrial Revolution had made Britain into a world leader, and they didn't want to fall behind. This meant there was going to be action. The Liberals won the 1906 election and promptly did as they promised. In 1906, the School Meals Act helped children who were poor get a free meal. By 1914, over 158,000 got one every single day. From 1907, all children had to be given a free medical check at school too. Back then, it cost money to get healthcare, but the government established free clinics to help deal with this. Special schools were set up to teach women about hygiene and childcare. And child neglect actually became illegal in 1908 with the Young Persons Act, a law that lives on in many ways today. For example, it came up with the rules about not having under 14-year-olds alone in the pub, no selling cigarettes to under 16s, and most importantly, to have regular inspections of the homes of children who had been reported as neglected. A National Insurance Act was set up to create an unemployment benefit. There was free medical treatment and sick pay for those who were out of work. Old age pensions were introduced, and job centres, although not seen so much today, were built and seen all over the country. A practical revolution compared to a few years earlier. This, of course, paved the way for some other huge steps like safer housing, health clinics, destroying the slums, and, of course, the NHS. Free school meals continue today, and there's a huge amount of free support for children. The difference between being a child today and 1900 is dramatic, considering that actually it's only been 100 years, which in the greater scheme of things is quite a short amount of time. So there you have it. That's how war led to a dramatic change. Thanks for listening and watching. Next week, we'll find out about why Queen Victoria has a peg on her nose when we find out about the Great Stink.